CBS 7 is continuing our Healthy Heart Month series, where this month, as you know, is American Heart Month, and we're finding different ways to highlight cardiac health. I'm here with Marlon Reeves, who works here at Medical Center Hospital. Marlon, what do you do here?
I'm a CT technologist.
Wonderful. And so you work here with this machine here, a CT scan. And today we're talking about our heart health. We're talking about a healthy heart scan that's actually available to so many people across the Permian Basin right here at Medical Center Hospital. Can you talk about what exactly this scan is all about?
Yes, sir. So what you'll get, you can schedule yourself. You do not have to have a doctor's order for this. So you can schedule yourself through the scheduling department. They'll put you on the schedule. We're going to do a CT scan of the coronary arteries to check for hard plaque or calcium on the coronary arteries. Then we'll take the patient over to the lab. They're going to draw a lipid profile to check the cholesterol. They'll fill out a BMI form, which is like the height, the weight, the blood pressure. Patients in and out really fast. We send the stuff to Dr. Bocalandro. He's our chief of staff for cardiology here at Medical Center. He reads all these. They'll mail the results to your home. The patients have the physician portal, doctors, they can see their stuff in the office. If the patient has the patient portal, they can see their stuff in the portal there as well. You'll get a report within 3 to 5 working days to take to whatever doctor you want. So if it's an out-of-town patient, they'll get the report in the mails. They can take it to whoever they like.
Incredibly comprehensive, just to show, from start to finish, this test covers really all the bases that you need. And also accessibility is the reason Medical Center Health System has made this so available to everyone, is that most anyone can come and get this test done.
That is correct. All ages. With pediatrics, we'd like to have people check with the doctor because it is a X-ray test. But if the child needs it, we've done it before because a pediatric cardiologist wanted it, and it's no problem. It's an easy test. But for adults, any age is good.
How much does this cost?
It's only $75. So right now, that's probably the best deal in medicine. These CT scans range from $2,000 to $6,000 just for the CT part, without the blood work, without a cardiologist read. And that's one of the main things, is you're having a cardiologist interpret the exam for you.
Absolutely. And so that's what we want to drive the point home. This is accessible to everyone for $75, where you can come and pay yourself and have all of these tests done from start to finish. And so for a patient who is walking through the doors here at the Wheatley Stewart Medical Pavilion, getting this scan done, this healthy heart scan, what does that look like for them, from filling out the paperwork to laying here and getting the scan done? What does it look like for them?
Typically, a patient, we have them all the way through the process in 30 minutes, and that's from the front door, the CT scan, and the lab work.
That's wonderful. And so where can we go to make an appointment and learn more about the Healthy Heart Scan here at MCH?
They have on the website, it's the Medical Center Hospital has the phone number for the radiology scheduling department, and it's 432-640-2255. And then they can call and they can get scheduled. They'll put them on the list for the first available appointment or whatever works for the patient.
Can you walk us through that? So you essentially walk the patient back. What do they do when they get back here?
We just come in, we'll lay the patient down on the table, we'll put some EKG leads on them to monitor their heart. We'll scan them. Once I walk out of the room, the test takes less than 60 seconds. We take the wires off, we take the patient over to the lab, they draw their blood, do the BMI, height, weight, blood pressure, and they're out of here. So it's a really fast process.
And what are they looking for when they do look at those scans that are done here?
Okay, so what they're going to take, it takes a lot of things into consideration. So they're going to look at the patient's height, their weight, their age, their gender. They're going to look at their blood work, and then we're going to show whether they have any hard plaque or calcium on the coronary arteries. If you have that, that's indicative that you may or may not have a stenosis or narrowing of the vessel. So that would say, they look at it, does this patient clear? Does this patient need to change their diet? Does this patient need to be put on some medication? Does this patient need to see a cardiologist for a heart cath procedure? So it can go from something really simple to something, hey, you need to, this could be really serious. You need to go in and see your doctor because you may have some serious blockage. So
important to get these scans done as quickly as possible for anyone.
Yeah, especially while we're able to offer this test. We are the only ones that I know of in this area that do offer this whole test, this whole process. That, when I say that, I mean we're the only ones offering the calcium score with the blood work, with the cardiologist read. And like I say, the cardiologist read's the most important thing. For $75, that's almost unheard of.
Wonderful. Marlon Reeves with Medical Center Health System. Thank you so much for your time today talking about this healthy heart scan available to everyone.
My pleasure. You come in, we'll take good care of your heart.